Do you have a heart? We don't. But if you do, it might stop working, in which case you may require a pacemaker. We'll start with Tyler, who will be discussing the relevant physiology and anatomy of the heart. I'm Will, and I'll be talking about the need for a pacemaker. Next is Yusuf, who will be discussing the system design of the pacemaker, followed by Max, who will be talking about the benefits and limitations of the pacemaker, and finally Indranil, who will be discussing future developments of the pacemaker. I hope you enjoy our presentation.
The root of the pacemaker, the need for it, and its design all stem from the biological cell, the neuron. The cell of the neuron has projections leading away from it called dendrites that collect the signal called an action potential from the previous cell. They also possess an axon to pass the signal on to the next cell. A complex system of these neuron cells working together forms the nervous system of the body. However, the heart has its own nervous system, independent to the body's central nervous system. The heart has two upper chambers called the atria that build up pressure in the lower two chambers called the ventricles, which then pump blood to the body. The nervous system of the heart starts at the sinoatrial node, a small section of the heart in the top right of the atrium. This section has neuron cells that are essentially leaky, letting chemicals slowly leak in but in a very controlled way, allowing it to time the heartbeat based on how much chemical has leaked in. The heartbeat is generated regularly here, independent of signaling from the body's main nervous system. The signal then travels through the atria, making them contract and squeeze blood into the ventricles. The signal delays when it reaches the next node, the atrioventricular node, to allow all of the blood to be pumped into the bottom chambers. Finally, the signal is sent down the bundle of His in the center of the heart to the Purkinje fibers, causing the rest of the heart to contract, delivering blood to the body. When the sinoatrial node, the natural pacemaker of the heart, fails, the atrioventricular node, or in cases where even this node has failed, cells further down may take over its function, generating a heartbeat. However, this is a much less efficient way for the heart to beat, because the second node puts out a less frequent rhythm, as well as the fact that the system of atrial contraction before the ventricle contraction is no longer fully functional. When breakdowns like this and other failures of the system happen, problems start to occur, and outside help may be needed, but that's for Will to tell you about.
A pacemaker is an electrical device designed to assist in the monitoring and controlling of a patient's heart rate. Doctors recommend pacemakers to patients with an abnormal heart rate known as an arrhythmia. Pacemakers are mainly used to treat bradycardia, a heart rate below 60 beats per minute, which is generally the result of a problem with the heart's electrical system, such as in the case of heart block. Heart block is a disorder where the electrical pulses through the heart are dampened or blocked from spreading through all of the heart muscle. A bradycardic heartbeat is often caused by heart diseases such as coronary artery disease and endocarditis, or by a weakening of the heart muscles due to aging. The pacemaker has been developed for patients whose natural pacemaker is not functioning properly and hence require an artificial one to speed up their heart rate. I will now hand over to Yusuf, who will talk about the system design of the pacemaker.
A pacemaker is an implantable device that uses electrical impulses to stimulate the heart to correct any abnormalities in its heart rate. Simply, a pacemaker consists of a thin metal case housing a battery to power a computerized generator that sends electrical stimuli down wires through electrodes into the heart. The generator and its housing is usually implanted in the chest, either subdermally or underneath the pectoral muscles. Only the wires enter the heart's chambers to ensure the implanting procedure is as uninvasive as possible. The wires are fed into the heart through the subclavian vein near the shoulder, moving along the blood vessel and into the superior vena cava and into the right side of the heart. Now there are three main types of pacemakers: single or double-chambered and biventricular. A single-chambered pacemaker has only one lead attached to the right ventricle to stimulate the heart. A double-chambered pacemaker consists of two leads, one in the right ventricle and one in the right atrium. This layout ensures these two chambers beat in sync and efficiently. Alternatively, the biventricular pacemaker has leads in the right atrium and both right and left ventricles. This allows coordination across the entire heart, but is only recommended for patients with severe heart failure. Now, pacemakers come in two main programmable forms dependent on the patient's situation: on-demand or rate-responsive. On-demand pacemakers only send electrical impulses if the sensors in the electrode detect too slow of a heart rate or if it misses a beat. Rate-responsive pacing increases the patient's heart rate according to metabolic needs during physical, mental, or emotional activity. This pacemaker sends varied levels of electrical impulses to adjust the patient's heart rate, depending on signals from the sinoatrial node of the heart and physiological signals such as breathing rate and blood temperature. There are no direct treatment equivalents to the pacemaker device. However, ICDs or implantable cardiac defibrillators are similar replacements. These devices are only recommended to patients at sudden risk of cardiac arrest or potential fatal ventricular arrhythmias, as it only sends electrical shocks to the patient if the aforementioned occurs. Furthermore, cardiac resynchronization therapy or CRTs are another related alternative to the pacemaker, though in simple terms they are just a combination of both an ICD and a pacemaker, used to resynchronize the patient's heartbeat. Now to talk about statistics, limitations, and benefits, we have Max.
Pacemakers have become one of the most widely implemented and trusted medical technologies. Through the use of pacemakers, patients with various heart conditions can have their life prolonged and general quality of life improved. Thus, the benefits of pacemakers are numerous. However, these vary depending on the existing condition the pacemaker is attempting to rectify and the other aspects of the patient's health. The major benefit provided by a pacemaker is the establishment of a normal sinus rhythm or heartbeat. With this, the common symptomatic issues associated with these cardiac conditions will be minimized. These basic symptoms include dizziness, fainting, general fatigue, and chest pain. Whilst pacemakers may not necessarily eliminate all these symptoms, many of them will be reduced or altogether alleviated. Due to this, pacemakers can be seen to improve quality of life, especially for patients who wish to remain physically active. Lastly, another major benefit of pacemakers is the reduced mortality rate. One estimate in 2007 claimed that pacemakers reduced hospitalizations by 37% and reduced death rates by 22%. In terms of the pacemaker's limitations, these are fairly minimal. However, there are still aspects that warrant discussion. Firstly, whilst pacemakers are fairly robust and highly portable, playing contact sports isn't recommended, as it can risk damaging the pacemaker, or it can cause the implanted wires to shift and detach. Both of these outcomes can endanger the patient's life. Furthermore, pacemakers often have finite battery lives. The battery life on average expires in 6 to 7 years after the original surgery. To replace the battery, surgery is usually required. However, this is generally less invasive and requires less recovery time than the initial implantation. Lastly, patients with pacemakers have limitations with respect to their exposure to magnetic and electromagnetic fields. Household appliances such as microwaves should have minimal contact with these patients. I will now pass to Ingenul to discuss the future developments and how these may overcome the current limitations.
Although the current pacemaker is quite effective in correcting cardiac abnormalities, complications can arise due to the design, namely from the pocket, leads, and batteries which are required to power the current generation pacemaker. Future developments can see the size of the pacemaker decreasing, with the battery life increasing. This leads me to one such device, which has already been developed by a company named Medtronic. Medtronic has developed a device known as a Micro, which is a tenth of the current pacemaker size and has a battery life of more than 10 years, and best of all features a leadless design, making this device as uninvasive as possible. The device is surgically inserted into the heart and is secured directly to the muscles of the heart using these hooks. The device itself is powered by a battery and works in a very similar way to current pacemakers. However, when it comes to technology, there is always room for improvement, and one such improvement could be the use of piezoelectric materials to make the system completely self-sufficient and remove the need for surgery due to device replacement or battery replacement. Piezoelectric materials are materials that generate a charge when they are deformed. Given the design of a Micro, a thin film piezoelectric could be implemented onto the hook of the device. These hooks are connected directly to the heart muscles and deform with each heartbeat. As these hooks deform, the piezoelectric materials deform. This generates a charge, which could then be used to charge the batteries and power the device. Research on piezoelectric pacemakers are quite well known, but now we have the technology and the electronics needed to push the boundaries of pacemaker designs further, making them more efficient, less intrusive, and virtually self-sufficient.